Hi everybody. Let me get my lights. How's everybody doing today? This is Labor Day weekend of 2024. Just so we have a date here. It's Sunday and turned out to be a little hotter here than it was supposed to be. Anyway, this is Grizzly Granny with Trike Talk with Grizzly Granny. And I thought it would be a good idea to discuss some of the first aid supplies that I feel are everyday carries when I'm riding my trike. A little later in the video, we might cover a couple things I leave in my vehicle. Now, many of you know that I'm a nurse, 45 plus years of nursing, and so what I carry may be different from what you choose to carry. So let's make this clear at the very beginning of the video that these are the things that I personally want to have with me. In the past, I've found that I needed, or I could foresee a scenario which I would need things that you guys may not think of or may not think you need. So that's fine. I'm just going to cover what I carry, might give you some ideas, and what you guys choose to bring along with you. It's totally up to you and your lifestyle and how you ride and where you ride and who you ride with. So anyway, let's go ahead and get started. Okay, so the first thing I would like to talk about is I think there's two levels of first aid supplies that are optional to bring with you when you are bike riding or trike riding. I like to call it my level 1 or level 2 supplies. What I would refer to as my level 1 supplies would be very minimal, very basic. We'll go over that in a minute. Easy to carry, light, doesn't take up much room. That would be just your basics. Level 2 or my trauma supplies is a more accurate term. So I carry additional items for more serious trauma. Just being a nurse and the first aid situations I've been involved in, not only for ourselves, for Gary and I and maybe my children and grandchildren, but someone who's had an accident along the trail and things that I've needed. So with that in mind, let's start with the first one. Now, I'm going to insert a picture here because I left my level 1 bag back at the trailhead in the truck. So my level 1 supplies would be simply a baggie, and I would put several regular Band-Aids. Band-Aids seem to be shrinking, so make sure you get a decent sized Band-Aid, and I would suggest the flex Band-Aids, the ones that are a little bit stretchy. They tend to have give, they're more comfortable, and they move better with your body movement. The next thing I would carry in those is the knee-sized bandages, which are going to be about this big with a non-stick surface. And then I always maybe just carry a couple of the big square Band-Aids, again for a larger, flatter surface. And I still go ahead and get the flex material in all of these. That's just personal preference. In that bag, I also have either a tube of antibiotic ointment, or what I've started purchasing now to save space is you can go on to Amazon or some other supply online stores, and I like to get the little flat single-use packages, say of bacitracin or something like that, or either have both, because some people might be allergic to triple antibiotic ointment, and for them another option is nice to have. The only thing that you might carry in addition to that a lot of people don't think of, that you can easily fit in the baggie, is possibly a little bottle of saline eye drops. You can get them in just the little, again, single-use, I don't know what you call them, they're little plastic and they're about this big, single-use dispensers, or you can get a little larger bottle, which I do have, but I don't put it in that bag. If you have medical training and know how to use them, you could also throw in some butterfly bandages. Those don't take up any room. And then you can do kind of a vacuum packing. Take that baggie and really squish the air out of it as you seal it. That will make a nice, flat, compact package that will fit in many places on your trike.
As you can see, I like to also add just a nice sharp pair of tweezers. They don't take up much room and they're great for removing little thorns or little slivers that you may encounter on the trail.
The next level up that I carry, and Gary, if you want to bring the camera over, I'll show you first of all how I mount it on my trike before I take it off. This is my trauma kit, first aid and trauma, my ouch pouch, and as you can see, this fits nicely on the back bar of my trike. And the way my trike is built, Gary, can you catch that? It just sits nicely on that little bar. Now, these are these military bags that I purchase. Come in, you can get them in camo or tan or black. What's really nice about them is they have the Velcro backing, and you can just rip the whole bag off the Velcro backing. I don't know if you can see that. So you don't even need to unstrap it. This will stay on your trike. But for today, I'm going to go ahead and we're going to unstrap it. Now there's a strap here and a second strap here. If time is of the essence, you want to know how to get these on and off. Okay. And you can see about how thick this is. I have a lot of stuff in there. But again, that's up to you. And what's nice is the front of these have some Velcro, so you can get some morale patches if you want, and personalize that a little bit. Here's mine. And I also carry this either inside. There's all these nice loops where you can attach things, but since I'm using it on the trike, this stays put pretty good, and this is just a little good quality flashlight. This comes in handy for a lot of things. You can look at a wound when it's getting dark, or you can check the pupils of the eyes. There's a lot of good reasons to have one of these with you, and I just keep it with my trauma kit. So we're going to unzip, and I'm going to be real careful here when we open this so everything doesn't fly out. This is a really nice little attached zipper pouch, so let's start here. I keep my small things. Now, rather than just having stuff loose in here willy-nilly, I purchased these really small food grade baggies on Amazon. And for example, now here I've got a few of my alcohol prep pads. I don't want to have to go digging when somebody's, you know, down on the sidewalk and needing something. I don't want to have to go looking for it. You want to save time. So I just put a few alcohol wipes in here, and then when I use them, I restock right away. Don't forget to do that. Let's see, just some other things that I have in here. Got a couple Benadryls. Now again, this is for myself and my family. You don't want to go administer medications to somebody. But it's nice to have these for your family or yourself should somebody have a pretty significant allergic reaction on the trail. And I've got some multiple allergies, so I like to have those handy. Here's these little bacitracins that I was talking about in a single-use packet, and look how thin that is. Takes up virtually any room. One of the things that I should have showed you first, I try to keep a couple of hand wipes or a small hand sanitizer, because you always want to start with clean hands. I also have gloves in here. Okay, so obviously I'm not going to go all through here. You guys get the idea. I take my nitrile gloves. I'm allergic to latex, and I know a lot of people are, so I don't carry anything except nitrile. And I can take a pair, I can squish them down, put them in one of these small baggies, push the air out, and it's amazing how compact they become. So what else do I have in here? Oh, this is kind of important that people don't think for a first aid kit, especially when you're riding your trike or biking or hiking. I carry moleskin and some different size callus pads. I always take the little discs that they have in the callus pads and the corn pads, take those discs out and throw those away, unless the doctor has told you to use those, because they are they're going to be trying to remove calluses and corns. We don't want to do that. We just want some protection in case we have a callus, corn, or blister. The callus pads with the hole in the middle are great if you get a blister, because that is going to take the pressure off the blister and you won't have anything sticking to that. So when you get home, you can attend to it without tearing the top off. You never want to take that top off of a blister. I carry small bandage scissors in here. I also carry a very, very small, this is a medical scissor, but you can also get a fine cuticle scissor. I take aquarium tubing, I cut a little piece, and that provides a nice protection for that point. So I don't get stuck, and neither does anybody else. I carry a small 2-inch ace. I was out of my tan one, so I got my pink one in here. You always need tape. Here is a face shield if you need to do CPR on someone. I have another face shield here, a keychain one. More gloves. I like to carry a measuring tape. Never know when you might need that to get a measurement. This is something I like to carry. This is toothache gel. Now, how many of you have that in your first aid kit? This is something we don't think of. If you bite your tongue, or you've got a sore in your mouth, or you get a toothache on the trail, just a lot of applications for numbing in the mouth temporarily till you can get help. Let's see, Coban. This is just about used up. I call this Coban. I'm not sure what the generic term for it is, but it's the stuff if you go get blood drawn that they usually wrap around and put your cotton ball in with. This is awesome if you've got a larger wound and you put a Band-Aid or some other kind of dressing on. I like to put this on the outside because it really sticks to itself, and don't get it on too tight, but you just want it tight enough to hold that dressing on till you get back to home or where you can properly tend to your wound. And this stuff is great.
Hi, fellow Trikers. Hey, I just wanted to pause the video for a moment to share with you some really important and shocking information. A person with severe bleeding or hemorrhage can literally bleed out or die within 4 to 5 minutes or so, depending how catastrophic their wound is, if left untreated within that time. Bleeding or hemorrhaging is the leading cause of preventable death in trauma, and about 40% of all trauma-related deaths worldwide are due to bleeding. So can you imagine if you are standing next to someone who has had a car accident or just cut themselves on glass or has had a stab wound or any one of another wounds that can cause hemorrhage, and you don't know what to do, and they literally pass away in that short period of time. I encourage everyone to find a Stop the Bleed class in your area. They're either free or low cost, they don't last too long, and they're very simple to participate in. And then get yourself a very high quality tourniquet to keep with you at all times. I will put some information down below in the description for you. And let's get back to the rest of the video.
Now, one thing that I carry always is for stop the bleed. And so I have a tourniquet that I carry in this pack. I have a tourniquet that I carry in my purse, and one that I carry in the first aid pack that I keep in my car. Go to a stop the bleed class. I'm going to touch on this later, but they're free or low charge. They're easy. They don't take long. Learn to use a combat tourniquet. These are becoming more and more popular. There's lots of YouTube videos on them, on the proper way to use them. Before you get them, you need to unwrap them and prep them for use. So that's what I've done here. It is ready to rip apart and get on if someone has a arterial bleed, such as upper arm, such as femoral. They can literally bleed to death in, say, 4 minutes-ish. You're going to run across a little bit different information, but around 4 minutes it can bleed out. Have one of these and learn how to use it. You probably will never need it, but hey, better to have it and not need it than need it and not have it. And I think these are really important to have. You can also put them on yourself if you're alone. The kind that I like the best is the CAT version, C-A-T. This is combat tested and recommended. There are other versions out there that are around $13, $15. Don't get those because they are just not going to perform as they need to. Studies have shown that. The CAT version is about $35 on Amazon, but well worth the money. Get this and learn to use it.
One thing I wanted to add along with the tourniquet is you should have the S-rolled gauze. Now, you'll be learning about that in the Stop the Bleed class, but that is used for packing the bleeding wound. And if any of you remember the big Curlex, the big fluffy Curlex dressings, that's what this is, but it's shrink wrapped down to a very, very little narrow size. And that is very important that you do have if you have your tourniquet to use for stopping bleeding. So I did want to mention that. Even though I'm not covering everything in my trauma kit, that was pretty important, wanted you to know. Two other items that I don't mention here in the video that are kind of important, I believe, is a pulse oximeter to see how much oxygen you have in your blood. And most of you know I've had lung surgery for stage 1 lung cancer, and I have about half my right lung missing. So I like to have that for myself and others. Once in a while, if I'm feeling a little short of breath, I might pull that out and just check my O2 levels and see, do I need to take a quick break or keep on going? And it's also good in a first aid scenario if you're trained to use those. I also carry a digital thermometer, nothing fancy, very inexpensive, but lightweight, portable, easy to carry. And there might come a time when, you need to check a temperature. So those are two other things I do keep in my level 2 trauma kit on my Trike.
I keep another larger scissor to cut off clothing if I need to. And I always keep a little notebook. Very good to have a little notebook and a pen. Got a wind gust here. Hopefully things won't blow away. And then I also have some of my larger bandages and non-stick squares and things like that. I also have a mask in here. I also keep a poly apron. From nursing, I have learned how messy things can get if you come across a trauma and you're helping them. This is kind of a nice little thing. It doesn't take up any room. You can get it in restaurant supplies, a disposable little plastic apron. That's not a have to, but it's nice to have. And then I also like to keep, I've got a lidocaine patch that's mine. Salonpas is a weaker lidocaine patch that you can get in the drugstore or Walmart. This is nice to have too. I've got a couple areas that I've got some nerve pain, and those come in handy if it hits me when I'm on the trail. Now again, most of this is for myself and my family. If you don't have any medical training, look up Good Samaritan laws in your state for rendering aid. But you know what? You could always tell somebody. We had a dad that was riding with his son and they fell right in front of us. And we got off the trikes and we offered, hey, we've got Band-Aids. Would you like one? You know, so you can offer that you have something without treating it yourself. So that's something to keep in mind in the litigious suing society we live in. But if you do have training and know how to use these things, this is what I like to have with me for my trauma kit. Now I keep a couple other things on my trike that I use often. Oh. Hey, here's one more really important thing. Electrolyte mix. Very important to have if you've got somebody that's getting dehydrated or getting overheated. This is a really good thing to have for use in an emergency. Okay, let's come on over to my trike. And let me show you a couple other items that I like to personally carry. So, as most of you guys know, I have some major low back issues. And sometimes I'll just get spasms in my lower back or in my hip area just out of the blue. And the only thing that helps even a little is ice directly on it. Well, ice with maybe a washcloth or something between the ice and my skin. So on all of our trike trips, in my trunk bag, I carry one of these chillers and then one of my ice packs. It's just starting to soften up a little. We're about halfway done with our ride here. So I keep that in my bag. And another thing that has really come in handy for us is one of these eye washes. They're basic saline. And have you ever been on the trail and gotten a bug in your eye or a fleck of dust? Man, this has come in so handy to do a emergency eye flush. A little big for my trauma kit, but I keep it in my trunk bag. Now, if you are asthmatic or you have any lung issues, you might want to make sure you've got your emergency medications like an inhaler, emergency medications for yourself and your family. I carry in my side bags these little guys, and I'm sure you have your own little containers. And I just put the medications I might need in an emergency in there. Additional heart medications and things like that. Also carry digestive enzymes in case we stop for lunch at a place and they're, restaurants can be a little on the greasy side, if you know what I mean. So anyway, emergency medications, of course Kleenex I keep in there. I keep an extra pair of reading glasses. And then I've got some knee issues, but it's on and off. And we've been out of town, and guess what? I left my knee braces back home in my bag from out of town. Anyway, if you'll come around here, I put a rollator bag. I customized it for my bike, and I don't know if it just hides, you can hardly see it. These are bags made to put on patients' walkers or rollators. But I altered the straps, and I've got Velcro on here, and I can get a lot of things in here like my rain gear and maybe a book if I want to read, or snacks. My wallet. I also carry a white garbage bag in case somebody gets sick, if you know what I mean. And this is where I normally keep my knee brace. I always have a lightweight knee brace. Man, Gary, I almost always get that about halfway through the ride and put it on. But I got out without it today. So that's where I would keep something like that that's a little larger that won't fit in your little first aid kit. So I would really recommend having at least a baggie. We'll show the picture insert with very basic bandages just to cover up bleeding until you can get home and properly care for that wound. you don't need to have a lot of stuff. That's very easy to carry, fits in a lot of tight spaces, and that's the very least you should have. If you want to get something a little more advanced, or you can think of things that you might like to bring with you, check out these really nice, get an empty trauma bag, or get one that comes pre-filled, but they're very expensive, and you could probably buy the same supplies and not spend that much money. I got an empty one and filled it with my own supplies, or as I said, you can get them pre-filled and then you can just add to that what you think is important. Hope this helps, guys. I hope you never need an ouch pouch on the trail, but if you do, or you come across somebody that needs assistance, you've got the supplies, you can take care of it until you can get back home and get proper care of it. That's it. So I thought you guys might also be interested in what I have with me in my vehicle. If you're not interested, you can just go ahead and stop the video here. But if you would like to know what I bring with me as a nurse, keep on watching for just a few more minutes. So I always try to bring a larger first aid kit with me in the vehicle. And since I am a nurse, I like to have more things at hand. I bring a knee brace, first aid book. I either keep this in here or with me on the bike. It's called the bug bite thing. I haven't used it yet, but they're supposed to be fabulous at extracting, if you get a mosquito bite, they're supposed to be pretty good at drawing some of the whatever substance they inject into you out. But again, I haven't used it yet, just recently got it, so I'll be taking it out of here and probably keep it with me on the bike. Anyway, I bring a blood pressure cuff, and of course a stethoscope. I've used these a million times. I bring a couple ace bandages because of falls and strains and sprains that we might get on the trail. I also have a complete bleeding control kit with a tourniquet, the cat tourniquet, which I recommend. And I have another one with me in my purse, and I carry one on my bike first aid kit as well. You know, you really should take this class. I know I've said it before, but generally these classes are free or no cost. They're very simple, and you learn how to take care of a catastrophic hemorrhage situation. You know, say, what if you're a bystander to an accident where the person is cut in a major artery, say the upper arm or the femoral artery, for example. They're going to pass away probably 4 minutes-ish, 4 or 5 minutes. You don't have much time. And learn to put these tourniquets on and how to pack a wound properly. Just pressure on a wound. I mean, it's something if you don't have anything, but it's not going to be enough. So learn about how to properly apply a tourniquet. And we've talked about that earlier this video, so I won't go into that. I always keep a little bug spray. I keep a little larger CPR mask for adults, kids, and infants. You can get just the little small shields that I like to keep with me on my bike first aid kit. Now, here's something that you guys should all have in your home and in your car. These are saving lives. This is called a life vac. It's a dechoker. It makes a tight seal around the person's nose and mouth and will help suck out anything that they have choked on. There's a valve, so when you first put this on, you get a nice tight seal, and then you push in and pull back on the on the little handle. Simple instructions come with every one. You can also watch on YouTube the lives you've saved. I saw a little kid was choking in a restaurant, a toddler, and the Heimlich wasn't working. The abdominal thrusts actually for an infant or a toddler. And so this guy gets up in the background, runs to his car, gets one of these out, brings it in, and he got the obstruction out. So I'd recommend getting the home kit because it comes with a practice mask. So basically you've got this piece, and then you've got an infant mask, and you've got an adult mask. And it also comes with a practice mask, so you can practice on your kitchen table. You don't want to practice on yourself because you're going to pull a bunch of bacteria up into this thing. This thing has a very strong suction. The Life Vacs are more expensive. I think this is around $75. There's another brand that's about half that on Amazon, but in reading the reviews, you want to go with the more expensive one if you can. And I'd recommend keeping one in your vehicle at all times and keep one in your home at all times. So that's what I always have with me. And just as an alternative to the baggie that I talked about earlier, your essentials, your Band-Aids, and maybe some antibiotic ointment and some Benadryl, you could put it in one of these nice little pouches, but look at the amount of room that takes up versus the baggie that I showed you earlier. I never use just what they come with. I always alter, add to the supplies that come in these. As a nurse, I know about other things that I'm going to need possibly, so I always customize my own first aid kit, and I think you should as well. Okay guys, thanks for watching. We so appreciate it. Happy trails, be safe out there, and until next time, this is Grizzly Granny and Gary holding the camera, wishing you a blessed week. Take care. And you know what? We'd appreciate a like and subscribe if you feel this information was valuable. Bye, guys.